Hello and welcome to Wellness Live. My name is Dr. Olivia Moses, and this broadcast is brought to you by the Living Whole Wellness Program right here at Loma Linda University Health. Well, it is October if you're watching us live. And in October, a lot of times we talk about women's health. And I have an exciting topic for us today. And the reason why I say it's exciting is because I get excited about talking about things that we usually don't talk about, but affects many people. And I think educating ourselves and talking openly about maybe some things in women's health that we kind of keep private or embarrassed to talk about, to get them in the open so everyone can understand and get help for these issues, I think is vastly important. So I have a wonderful speaker here with us today. Her name is Dr. Lindsay Zintofer, and she is a physical therapist. And Dr. Zintofer has been here at Loma Linda for 13 years in total, and she is a very specific specialty in physical therapy. Now, we have wonderful physical therapists here, and you may not even know all the things physical therapists can do. And one of them is to talk and to treat pelvic health issues. So she has actually had additional training other than being a physical therapist, in addition taken a test to get certified. So she is actually a pelvic rehabilitation practitioner who is certified in this specific area of physical therapy. So she's the perfect person to talk about pelvic health, which again is something that we should really be talking more of, because a lot of people suffer in silence. So without further ado, I'd like to introduce you to Dr. Lindsay Zintofer.
Hi, Dr. Moses and everybody out there. Thanks for having me today. As Dr. Moses introduced, pelvic physical therapy is a specialty that within physical therapy, we still work with your muscles, we still work with your joints, but it does address a lot of conditions that some people may not think of as physical therapy, and often that go untalked about because it can be very private or can be associated with embarrassment or shame, or that people just don't realize is a problem. So that is why we're here. And I want to be able to talk more openly about some of these things so that people can feel more comfortable, hopefully in the future. But let me switch over and I'll share my screen. Yes. My button is gone, guys. I don't have the option to click share. Is anybody able to help with that?
Let's see.
When I click share screen, it doesn't, the like button to allow me to share doesn't work.
So can we try again? There we go. I can see your screen. Can you see your screen?
I'm not sure that I shared that. I think someone else might have, but that is the correct screen.
Okay. Well, if we can work with this. Yes.
Yes.
So thank you. And thank you all in the audience for bearing with us.
So, as again, I am a pelvic health physical therapist, and I want to talk about some things that we don't usually talk about, but actually are very important and life-changing. If you can go to the next slide. So my goal today is we'll talk about what pelvic floor physical therapy is. A lot of people may never have heard of this, or maybe you've heard of it, you just don't know what we do. We'll talk about anatomy and how our muscles and bones function to help our systems. We'll talk about common conditions and symptoms that we treat. And then I'll give you a few specific case studies. If you can go to next slide. So this is a really, really important topic. And I think a lot of people don't recognize how common these things are. A huge number of primarily women experience urinary incontinence. This is where urine leaks out of your bladder, and for many different reasons. And so, and you can't control it. Most people don't like this. It's uncomfortable. It's embarrassing. Some people think it's just normal, but it isn't. It is just common. This can happen to women of all ages. college athletes can experience this. It's very common with people who have had a baby. It's also very common as we age. Another common thing is pelvic organ prolapse. 50% of women have a prolapse after they deliver. This is a really big thing for women. They come in here and they're like, oh, I just saw the doctor and I was told I have a prolapse and this is going to be bad. My mom had surgery. I don't want that. And so there's a lot we can do before people even get to something so significant as surgery. Men also experience pelvic floor issues. Common things are after having surgery, like a prostatectomy, or after having some kind of fall or injury, men experience pelvic pain and benefit. And then also, like I said, there's a huge impact to quality of life. It is not uncommon for people to avoid doing things that they like. They'll avoid going out. They have to plan ahead to carry different supplies and a change of clothes. Or they'll avoid spending time with family or lifting their grandkids or it's hard to work sometimes. And so there's a huge impact on quality of life when people have problems in this area. Next slide. So a brief anatomy overview here. The main thing that we focus on are the pelvic floor muscles. These are muscles that make up the bottom of the pelvis, and I do have a picture coming up. They provide support. There are sphincters that keep things in. And the pelvic floor muscles play a big role in sexual function, and then they also hold our pelvis together to give us support and stability for the pelvis. Not only do we specialize in the pelvic floor muscles, though, there are other muscles that coordinate and have to coordinate with the pelvic floor so that we have optimal function. So our diaphragm, that's under the lungs. I have a picture later. Diaphragm, breathing, those coordinate with pelvic floor, the abdominal muscles, and the muscles of the back, the multifidi specifically. Organs in the pelvis, bladder, uterus, prostate, rectum. The pelvic floor muscles provide support to all of these organs. And as I like to say, they keep things in or let things out. And our goal is to have control so that things aren't going out when we don't want them to. Nerves also go through the pelvis. Some of the main ones are the pudendal nerve, the sacral plexus. If there's something going on wrong with the muscles, then it can cause nerve problems, which can then cause pain or discomfort or something else. So nerves are important. Next slide. Here is a lovely picture of the pelvis. As you can see, there are multiple bones that make up the pelvis. Primarily, there are two halves that are made up of three bones that are fused together. And then in the middle, in the back, we have the sacrum, which is 5 vertebrae fused together. And below that, the coccyx, another 5 vertebrae fused together. And there's a joint between the sacrum and the coccyx. People can get pain at the joint between the sacrum and the pelvis on each side. People can also get pain in the front of the pelvis at the pubic symphysis. So those are some bigger areas that we can address. Next slide. Very important to your pelvis. I put this slide in to highlight it's not only the muscles that provide stability, but we have ligaments that provide stability. This is a view of the back of the pelvis. All of those white things are ligaments. They are thick, tough, fibrous. Typically, they don't allow very much movement, but there's a small amount of movement that can happen. And people get more pain or problems when the ligaments aren't doing as much as they should or could, or when we have injury. Next slide. Here, this is the bread and butter of what we do, the pelvic floor muscles. What I really want you to take away is if you see all of the red, those are the muscles and they make up the whole bottom of the pelvis. There really isn't any bone down there or any other support structures to hold everything up and in. All of the organs of our abdomen rest on these muscles. So the picture a little bit to the left is looking top down. You can see the muscles. And then the picture on the right is looking bottom up, and you can see that there are some muscles that also go around the holes that we have through the pelvic floor. In this pelvis, there's one for the anus and one for the vagina. Next slide. Here again are the other muscles that we work with all the way to the left. These are the multifidi. They work a lot with spinal support, posture. Next slide over, the diaphragm. You can see that it goes under the lungs. And when the diaphragm moves, it moves in parallel with the pelvic floor. Breathing and pelvic floor muscle control really do work hand in hand. And so often we'll address breathing. The next final picture all the way to the right shows the abdominal muscles. There are multiple layers of abdominal muscles. People can have injury to these muscles when they have surgery. People can have weakness to these muscles, and these play a very big role in providing support to the pelvis, support to the posture, support to the trunk. So we work with these muscles a lot as well. Next slide. Here are the organs. Pelvis on the left, you can see like in the abdominal cavity, the bladder, the rectum. This happens to be a pelvis including a penis and prostate. And then on the right is a pelvis. You can see bladder in the front, uterus kind of in the middle, rectum in the back. They all sit very closely together, and all of them rest on top of the pelvic floor muscles. Next slide. So here's my favorite part. This is what we actually work with. So this first slide of common conditions, urinary incontinence. There are different kinds of incontinence that people can have. The main ones are stress incontinence or urge incontinence. Stress incontinence is where we leak with a laugh, cough, sneeze, jump, lifting. It's some force on the bladder pushing urine out when we don't want it to go. And then the other main kind is urge incontinence, and that's where you feel a strong urge to urinate, and then you can't make it to the bathroom. It's very embarrassing, very uncomfortable. These happen for different reasons. And so part of what we do in pelvic floor PT is to identify what kind of leaking people are having. Sometimes people can have both, and that's what the mixed incontinence is. And once we identify what kind of leaking, then we'll treat it. Stress incontinence, we treat a lot with strengthening. Pelvic floor muscles can be tight, where they're too tense, and that's the one exception to strengthening. If muscles are tense, we need to teach them to relax. But for many, many people, strengthening is Kegels. Squeeze your muscles, hold your muscles, relax, repeat, and then do it a lot. Urge incontinence is different because it's usually not just a strength issue. Usually there's something else that's irritating to the bladder. It could be something that we eat or drink, or sometimes we can create habits with when we go to the bathroom that then cause us to get into routines of needing to go at certain times. So with urge incontinence, usually it's more of a behavioral thing that we treat, but it's always looking at the individual, looking at what's happening in their life, where their specific issue is, and then addressing that directly. Pelvic pain is another very big area, and it's such a broad term. It could cover musculoskeletal. So I had pictures up of, the bones, the muscles. Someone could have pain because they're getting too much movement in a joint. Someone could have pain because their muscles are too tense, just like you might have a, knot in your back. Someone could have pain when they're pregnant, and that is typically because of changes in hormones and ligamentous changes. And then chronic pain is another thing that we can treat. Could be any combination of these things. Pregnancy, postpartum, we treat a lot of patients who are, before they're pregnant, during pregnancy, after pregnancy, working with typically the pelvis, listed here, diastasis recti, that's where the abdominal muscles separate. Very, very normal in pregnancy. Usually goes away on its own after pregnancy. But with pelvic floor therapy, we can strengthen the abdominals and try to make that happen more quickly. Prolapse is incredibly common, like I had earlier after delivery. It's incredibly common, but I also want to highlight prolapse isn't only caused by being pregnant. It can come from any straining. So, a lot of what we talk about, and I do touch on this later, is managing pressure in the abdomen to avoid straining. And then again, for the pregnant postpartum population, how to recover after delivery. When can I start exercising? What should I do? It hurts when I have sex. What can I do about this? And this is very, very important. I think for a lot of people who are pregnant or have been pregnant, there's a big, big focus on you're pregnant, yay, or how do I get through pregnancy and delivery? That's so scary and so new, but not as many people talk about what happens afterward. This is a big reason why I got into pelvic floor physical therapy, because after I had my kids, I was like, what just happened to me? When can I start running again? And I felt like I couldn't get the answers that I needed. So then I wanted to make sure that I could share this with everyone. Next slide. Yay, questions. Anything yet?
Yes, well, thank you, Dr. Zintofer. We do have some questions coming in. And one of the questions that we have, and I also want to remind our audience, if you're watching us live, please go ahead and type your questions in the comment section or the chat section. We'd love to ask Dr. Zintofer right here live your questions. So a couple questions here are there any lifestyle factors that affect pelvic floor function that we can, do to keep our pelvic floor healthy?
Ooh, I love that you asked that. Somebody out there, thank you. Absolutely. Yes. So, one of the big things is our diet. There are absolutely things in our diet that can affect our bladder. It can give urgency, a feeling of needing to go all the time, and discomfort. It also affects our bowel. And that's in my next slide, but in pelvic PT, we address bowel dysfunction, constipation, diarrhea, inability to go, and diet plays a huge role. If someone has, can I get a picture? This is one of my favorite slides. I'm grabbing a picture. Can you see this?
Yes.
This is something I show all of my patients. Stool consistency plays a role. And so one of the big things we address is stool consistency. Our goal, okay, this is good. I get to teach everybody. Our goal is to be here, firm, held together, not too hard, not too soft. And diet is the number one way we get there. If someone has some stool inconsistency problems, it's really hard to keep it in or to let it out. And so, yeah, diet plays a big role. Other
Okay.
things. Okay, go ahead. Sorry. Yeah, I could.
Oh, no. So what kind of diet? Is there anything specific in the diet that you could recommend?
Sure. And now I want to put this out there. Not everybody has problems with these things. So, for bladder, some of the more irritating things for in the diet can be anything caffeinated, anything acidic. So that would be citrus juices, tomato sauce, anything carbonated can be irritating for people. Carbonated water is really popular, and for some people that's really bothersome. Any fake sugars can be very bothersome for people. Alcohol can be very bothersome. But I also want to say not everybody is bothered by all of these things. And in the end, it's a choice on what you wish to eat or drink. So, I like black tea. It has caffeine. Maybe it gives me symptoms. Sometimes it's worth it. Sometimes it's not worth it. And I can decide that. And then for bowel, the big ones are to have a healthy diet, which I know we emphasize here at Loma Linda, but eating plenty of fruits and vegetables, making sure you get enough fiber, These are some of the big things that will just improve gut health. And then there are irritants for the bowel, anything spicy. For some people, gluten is pretty bothersome, dairy. Um, for some people, the gluten and the dairy can cause bloating and abdominal pain and constipation or diarrhea. And so, if someone is experiencing those symptoms, I might recommend, why don't you try adjusting your diet?
So we have another question that has come through is how do you address individuals or patients that they are kind of suffering in silence or they think it's normal, like I'm getting older or I just had a baby, those types of things, or even men who say, well, they don't even think about their, pelvic floor, that's a woman problem kind of thing.
Sure. Um, I mean, for someone to make it in here, into my clinic and for us to talk about it, clearly they must have, someone said, hey, that's not normal. What I first try to do is to let them know that actually what you're experiencing isn't normal. And it be very, very common, but it is not normal. And there's a lot that we can do to make it better. And so that's I think the place to start. A lot of people think, oh, I just getting older. This is what
Right.
happens. It happened to my mom.
Mhm. So, what are some of the common things that people think are normal that you actually treat? And you talked about it. So, incontinence is probably one of the big one, urgency, those types of
Mhm,
things.
mhm,
And so, if their people
mhm.
are feeling those, can they call their doctor? Do all doctors know to put in a referral to PT? Like, how does that whole process work?
Yeah, good question. So I think you're like incontinence. Yes, that's one of the things that people go, oh, that's kind of normal, right? Pain, people usually don't accept as normal as much. Um, Usually, our referrals come from primary care physicians, or a primary care physician might send someone to urology. Usually for pain, they'll go to urology or OBGYN or urogynecology before they get a referral to us. But it could come from, those are the main referral sources
Mhm.
that we
So
get.
this is something that a patient can go to their physician and say, I heard there's a specialty in PT. Is that something?
Yes,
Okay,
absolutely. And
perfect.
I think with the prevalence of social media, this is becoming more and more common. I have a lot of patients that say, oh, I saw this on TikTok. This person said, what about, you could try these exercises.
Mhm. Perfect. So we have a question that actually comes from our YouTube audience. It says, "Are there good therapies to do after prolapse surgery?" So is that something that you would recommend they come see you, or is there things that they can actually do on their own?
Um, a little of both. So basically, for anybody who doesn't know, prolapse is when the organs start to fall down lower. We have ligaments that hold our organs up, and these ligaments can get stretched out, and then the organs start to sit down lower, sometimes into the vagina, sometimes coming out of the vagina. And so the surgery helps, it just lifts everything up, resecures it into place. Usually people feel great after surgery. But the reason why they needed surgery in the first place might still exist. For example, if someone is constipated and then they have to strain to have a bowel movement, that straining is pushing down on the organs and it can stretch out the ligaments. So surgery can fix it once. And then if you don't fix the constipation, then you can stretch it out again. Um, so in general, after prolapse surgery, the stronger you are, the better. Leg strength is important. Pelvic floor strength is important. Um, Fixing anything that makes you strain is important. So these can be done on your own. Sure, go to the gym. Most things are okay. If you follow some basic, don't hold your breath when you exercise, don't strain with a bowel movement. You can do that on your own. But if you're not sure about it, if you haven't worked out before, then PT can be helpful. Or if you're having pain after surgery. And I talk about that a little more next.
Okay. Well, speaking of, that's a great segue to get to your next segment.
Perfect. And I'm hoping my friends are going to pull that up again because I'm powerless. Thank you so much. Okay, so next section of topics and things that we work on. I kind of said it already, but bowel dysfunction. We address constipation, fecal incontinence. I want to make it very clear that we are pelvic health physical therapists. Yes, we specialize in the muscles, but there are also some very basic dietary things that we can inform people about. So I do make some general dietary recommendations, but I am not a dietitian. And I will tell my patients that. I say, if you haven't tried this, if you haven't heard of this, eat more fiber. Let's adjust your stool consistency. But I also tell them I am not a dietitian. So if you've already tried this, seeing a dietitian is very helpful because stool consistency matters. But pelvic floor muscles also matter. If your muscles are too tight, then they don't work well to let things out, and that can contribute to constipation. If the muscles are too weak, then they don't hold things in, and that can contribute to incontinence. Sometimes also people can be uncoordinated. You might try to have a bowel movement and you think you're pushing down to let something out when actually the muscles are contracting. So we work to assess the muscles, make sure they're moving the way they should, and then to teach new patterns if we need to. Male pelvic health. Yes, absolutely. We work with male patients as well. One of the big areas is post-prostatectomy. Urinary incontinence is very, very common after having the prostate removed because there's a piece of the urethra that goes through the prostate as well as a sphincter muscle. And these can be the urethra piece is removed, anatomy is reconnected, readjusted, and that sphincter is also damaged or removed. And so people will leak urine. And so then they come to us. And what we work on is strengthening the pelvic floor muscles to be able to control that better. Usually after a prostate surgery, people can have leaking. A lot of men don't think about Kegels because they're not taught this in the same way that women hear about it. And so we make sure they're performing them correctly using the pelvic floor muscles, not the glute muscles. And then we'll talk about specific situations, which I'll touch on that later. But for some people, it's like, when I do this, I leak, and we'll address that specifically. Pelvic pain for men is another issue. This is more common after some kind of injury. A fall onto the tailbone, a fall onto your bottom. Those are the more common reasons for pelvic pain, or cycling. Cycling is a great sport, but it can also just put a lot of pressure on the perineum. And so when people have pain, then they can come to us and we try to identify why they're having pain, what muscles or what's contributing to their pain, and then we can give them specifics. And then urinary leakage, as I kind of touched on before, it's not so common for men unless they've had prostate surgery. Because of the anatomy, men have a longer urethra. It has a couple more turns through the penis. So usually men do not have urinary incontinence the way that women do with a shorter urethra. And then my last common conditions, post-surgical recovery. This includes any surgery someone could have for the pelvic floor or abdominal area. So hysterectomy is a very common surgery. C-section after delivery, very common. Any abdominal or pelvic surgery, hernia repairs, gallbladder removal, any like colon, gut surgeries. Appendicitis less common, but anything that creates an incision, creates a scar, can cause some pain for the abdomen or pelvic floor, or discoordination. Imagine if you had a shoulder surgery, your shoulder muscles don't work quite as well immediately after surgery. They're sore, they're painful. And so physical therapy helps get your range of motion back, helps get your strength back. It's similar after any surgery in the pelvic area. Next slide. So a lot of people come to pelvic PT and they have no idea what we do. They're like, well, I've heard of PT for my knee. We do exercises, right? But for pelvic floor, they're like, what does that look like? So the number one thing that we do is we talk to the patient. We find out what's going on for their different systems. I will ask about bladder function, bowel function, sexual function, and pain for all of my patients. Because often when you have a problem in one area, you'll have another problem in a different area as well. Not always, but it can. We'll look at someone's posture, how they breathe, how they move. Again, as physical therapists, we work with the muscles. We're looking for something that is too tight or too weak or just not flexible. And then we address those specific things for each person. Definitely, we assess the pelvic floor muscles. This can include, for most people, we would have them undressed from the waist down. We would look at the perineum. That's the space, kind of between your legs, your groin, your vagina, your vulva. I don't address like penis and testicles so much, but that space kind of below that and around the anus. If someone's uncomfortable, I want to make it very clear. If this does not feel okay to you, if for any reason that someone does not want this, they don't have to do it. We can talk through this. I can give out a self-assessment like tool, a handout on how to do this at home. And someone could look at their anatomy and then do an assessment from home. But if people are comfortable, then we would do this in the office. For anybody with a vagina, it will often include an internal assessment as well, where I press on the muscles from the inside, looking for anything that feels tense or tight, like a knot that someone could get in their back. It's the same thing on the inside. And then we assess strength. Can you squeeze your muscles? How long can you hold your muscles? Do your muscles relax? Can you lengthen your muscles? For people with a vagina, we'll do this through the vagina. If someone doesn't have a vagina, we can do this intrarectally as well. And for someone to say they're a pelvic health therapist, ideally they've been trained to do all of these things. And then last but not least at all, education. We talk about anatomy, how our bladder, bowel work, and then different things to do. I think I can't emphasize enough how important education is for most people. You learn about your bladder or bowel when you're potty training, when you're 4, 5, 3. I guess my kids were young. Yeah, 3. That's normal. But after that, we don't talk about it. So people don't know what normal is because, they just start using the bathroom on their own. So education on how things work, why we do different things, why these work is really, really important. And most people come away with like, wow, I had no idea. And that's one of the benefits of pelvic floor PT. I'm sure we're not alone in knowing this information, but we also have the time and we meet with our patients one-on-one. And so we have enough time, regular visits to share information. Next slide. So different things that we can do in therapy. Similar to if we were working with someone's back pain, we can do manual therapy. We can work with the muscles directly. We can mobilize their pelvis or their joints. We absolutely do exercise. I kind of said it earlier. We can work on coordination, making sure your muscles squeeze or relax as you want. Strengthen if they're weak, relax if they're too tense. Breathing and pressure are very, very important for someone who has a prolapse or leaks urine. Pressure management is one of the number one things. So I kind of said it again. Anything that causes someone to strain puts extra pressure on the pelvic floor. So we'll look at what they're doing in their daily life and talk about how we can reduce the pressure on the pelvic floor. Behavioral, this is addressing, dietary changes, habits, and making sure that people, go to the bathroom when they should, don't go to the bathroom when they shouldn't. And these are things, we're kind of taught as kids, but sometimes we can pick up pick up things that aren't the best for us. And then lastly, posture, body mechanics, activity modification, it kind of goes through all the other things, addressing pressure, addressing how we do our activities. Next slide. So just a few different generic examples. I'm combining patient stories for these. Example one, postpartum patient comes in and says, oh, I delivered my baby 3 months ago. I leaked urine really badly in the first few weeks. It's gotten a little better, but I'm still leaking urine. When I leak, especially when I'm sitting and, sitting crisscross applesauce and I'm breastfeeding and then I cough and then I leak. And I want to get back into running, but when I tried to jog a few steps, I leaked and I'm using 3 pads a day. What should I do? So we look at what they're doing, positions, generally strengthening the legs so that their legs can support when they run, strengthening pelvic floor so that they can engage their muscles as they need to when they cough or when they run. And then typically, it takes a little bit of time, a few more weeks, but once people start to do these exercises, they'll have improvements, within a few weeks or months. Example number 2, I had a male patient who he had a prostate surgery. He came in. He had read about Kegels. He did a lot of research online. And when, I said, just in the office, he was still fully dressed. And I said, okay, show me what you've been doing for a Kegel. And he squeezed his glutes together. Those are the muscles of your backside. And I could see his whole body lift up in his chair. And so then I said, okay, when you squeeze your pelvic floor muscles, we want to squeeze, from the inside. Imagine you're holding in gas. So educating on how the pelvic floor muscles work, what that feels like. And then for him, it was adding more. He was doing them a little bit. I did them some, he said, but I said, okay, we need to do them more often every day, hold for longer. His biggest concern was that he worked in the higher education, and in order to return to work, he may not be able to go as often. And so we worked with practicing holding the muscles. And then there's a few other strategies we talked about to be able to help him to be more successful when he went to work. And then eventually, he did. And with practice, he got stronger and it worked. He was able to go back to work, very happy. And then my third example, someone with chronic constipation. So the first thing we address is the stool consistency. If stool is very, very hard, then, we talk about drinking more water, eating more fiber and different kinds of fiber, looking at what they're eating, making sure, that they're not eating anything that could possibly be irritating. And then if we can improve the stool consistency, then we also look at muscle function. It's very rare that I'll get a patient who has poor coordination, but it can happen. So again, someone who tries to have a bowel movement and squeezes their muscles initially will practice squeezing and lengthening. I had a patient who did have a difficult time lengthening. They couldn't push down. And so in the clinic, we used a mirror and I held it down, between his legs so he could see what was happening. And then I said, okay, squeeze. And he could see that. And I said, relax. He could see that. And then push down and he squeezed again. So then we practiced it. Okay, squeeze and then push all the way out. And then with the use of the mirror, he was able to see what it was. And then it helped him improve his use of his muscles with bowel movements. So those are a few examples of how we'll work with different types of conditions here. Next slide. All right. So again, one of the really important things for pelvic floor PT is this is just something we don't talk about. I am very passionate about talking about these uncomfortable things with people. It's not uncommon in the clinic for people to say, you know, I've never told anyone before, but this happens. Or this might be TMI, which is my favorite thing, because the answer is no, it's never TMI. Please do tell us. But when someone says, this might be TMI, this happens, usually it's very relevant. And our goal in pelvic floor PT is to make this a safe place for people to talk about things that are uncomfortable or that we don't talk about. I frequently have long conversations. I mean, again, urinary function, when we leak, the specifics, bowel function, when are you having accidents, how often do you go to the bathroom, sexual function. This is something we don't talk about much. I do work more commonly with women who are having pain with sex. Um, Pain is not normal, and there's a lot that we can do about it. And that's one of the areas that often women suffer in silence, but men as well. It is not normal to have pain with sex or with erection or arousal. And so, if someone is experiencing these things, the first place is talk to your doctor. But then, yeah, come here and we'll talk about it and we'll figure out what's going on. Common myths, just do Kegels. No, Kegels are not the answer to everything. They are very important. And for many people, they are helpful. But there's not one solution that works for everyone. So it's important to figure out what's going on so that we know how to address your specific situation. And then again, that this is normal with age. It's a lot of women that I work with say, "Oh, I thought I'm just getting older. I went through menopause. That's how it happens." Or, "No, I had a baby." And, that's just my mom said that's normal. Some things, yes, change is normal. Things are different, but there are things that are not normal and we can make better. And so I'm always happy to have people come in and talk about what they've experienced, things that are different, and see what we can do to help. And yeah, normalizing these maybe uncomfortable topics or less commonly talked about topics is really important. I encourage all of my patients, please tell your friends that this exists so that we can get the news out there and they're able to spread the word of pelvic floor PT. Often, if we treat something earlier, then we can make a bigger difference. If someone is 40 and they're leaking urine, well, yes, come in, because when you're 40, it's easier to put on muscle and make changes. But if you're 80 and having problems, still come in, because at 80, we can still make improvements. But I'd rather see you sooner so we can prevent things from getting worse. Yeah. So pelvic floor PT, we're here. Come talk to us about your weird things. I think that was my last slide.
Thank you, Dr. Zintofer. So appreciate your time today. We have run out of time, but I think the big take home message here is we are embarrassed and there's shame around certain parts of our bodies, but we are whole people. So the more we talk about it, the more we ask for help, the really we can save ourselves a lot of pain and turmoil. And from what you just said, we can feel better in a few months or even a few weeks, just by talking about it and going to, because some of the procedures that you talked about and some of the therapeutic things that you do may freak some people out, but also a take home message is you will talk to them about being comfortable and do what is comfortable.
Absolutely.
Yes. Well, I want to thank you so much, Dr. Zintofer, for sharing your expertise with us here at Wellness Live. And I want to thank our audience for visiting us today and invite you to November. So November 20 will be our next Wellness Live, and you don't want to miss it. So I want to